So are you going to get the vaccine when it comes out? I've heard that
Mhm.
question about 100 times. Oh my goodness. Are you going to get it?
Mhm.
Do you know what's in I don't know what's in it. I don't know if I'm going to take it. Like we all know what's in everything, like Tylenol or a Pop Tart.
Yeah.
He knows. So the question is, the COVID vaccine, is it going to be safe for you to take? Should you take it? Should you not? We have somebody here that has some answers for you.
That's right. He is Dr. Jeff Morawski, Chief Medical Officer at Silver Summit Health Plan, joining us once again. Welcome back. Yeah, it's funny because I've actually asked that question of two people today, so it's on the top of everyone's minds. Please share your
Hmm.
thoughts on why it's so important.
Sure. So my arm is warmed up. I'm ready to go as soon as it's my turn. So first thing is I'm getting the vaccine.
Mm-hmm.
My family's
Mhm.
getting the vaccine. I'm encouraging everybody I know to get one of the vaccines that's going to be available.
Yeah.
There's two right now that are available. They are very safe. Large clinical studies where they looked at people who participated in these trials, tens of thousands of people
Yeah.
who took the vaccine, and they recorded their side effects. They're all doing great. No major trouble. It's a lot safer than many of the things we choose to do like cross the street.
Yeah, well, there's that for sure. I mean,
Mhm.
I think, yeah, it's kind of like, you know, it reminds me, it's like the fear of flying. Oh, I won't fly. I'd rather drive. I'm like, you know how much more dangerous it is to drive, don't you? It's like way more dangerous to drive. It's the same thing with this. I
Mhm.
think people
It
kind of get
is.
sucked into these Facebook debates and, oh my goodness, and it becomes this big panic. And in actuality, like now at this point, millions of people have gotten this shot.
Yeah.
And,
Yeah.
you know,
And
people
we
are
learn
throwing
more every
tails.
week. Yeah, we learn more every week. Risk versus reward. The reward is you've got two vaccines that are 94 for the Pfizer and 95 for the Moderna
Which is
percent
amazing.
effective. And
Sick,
those are
man.
amazingly high numbers.
Mhm.
Flu shots usually between 40 and 60.
Yeah.
So this is pretty good. This is up there with polio in terms of how effective the vaccine is.
Phenomenal.
And, the safety profile is, again, way safer than doing things we do every day.
Mhm.
So, Dr. Morawski, for those folks who know, they're certainly wanting to get it. They're waiting to get it. There's some practical questions. Where do I go
Sure.
to get it? And what about cost? Will insurance be
Sure.
covering this in many cases? I don't even know the
Well,
answer.
I think the second question is easier than the first one. So the first question is everybody who wants a vaccine can get a vaccine, and there's no cost to the people who are getting vaccinated. Whether it's your insurance or the government, it's going to be covered. So no cost to you, no matter who you are. That's the most important thing. In terms of the when each tier is going to get it, that's really going to be driven by supply. So right now, the state's in tier 1A, which is healthcare workers, and that's not all of them. It's healthcare workers that do frontline work with COVID. They're
Okay.
still getting through those.
Mhm.
And each county in Nevada has their own plan, and they'll move through that group. Once we get through that group, we'll move on to two-tiered population. So one is kind of thinking about what you do, and the other is who you are. The who you are group is 70-year-old and older first, then 65 and older, then between 16 and 65 with chronic health conditions. That's kind of the general population. And then we've got some based on what kind of job you have. The rest of healthcare workers, then you move on to things like teachers and police officers and first responders and people who run our utilities, and then grocery store workers. And there's another moves down through those tiers. And again, that's driven by how much supply of vaccine we get, how fast.
Gotcha. Obviously, you know, the whole vaccination thing seems to, it causes a bit of an uproar with some people. They're, you know, it's my right to not be vaccinated. You know, I don't want my kids, by the way, under a certain age, I think under 16 or under 18 years old,
16.
are not
Yeah.
getting this. Not
Right.
yet.
So we're not
Hasn't been approved
vaccinating
yet.
15 and younger. We're
Yeah.
not doing that group. We haven't got enough data yet. We may, with one of the vaccines in the pipeline, be able to go down a little lower, but that's what we're doing.
But for people that might be anti-vaccine, what do you have to say for that? Like, how do you respond? Because we know how we need to get a large swath of the population to get it in order to stop this.
Right. So I always tell people, first of all, right, we want to be vaccinated so we protect ourselves, but we also get vaccinated to protect others. Because there are people who've had a serious allergic reaction to a vaccine in the past, meaning like you had to get epinephrine, you couldn't breathe.
Yeah.
Those people shouldn't get the vaccine right now. And so they're at high risk. We get vaccinated for them. We stop at stop signs because the stop sign says so, right? So we don't run a light and hit somebody. we choose to do things all the time for other people as part of a society. We share the road. We don't, well, we hope we do. So we do this to help other people, not just for us. So yeah, it may be my individual right to be vaccinated, and I value those individual decisions I make just as much as everybody else does. But I also do things for others more important, and this is one of those times.
Yeah.
A great point, Doctor. You know, I have someone in my family who is not going to get the vaccine. And the other concern I have for them is, well, you're probably going to get COVID at some point then. You should just plan on that. Isn't that sort of part of the course if you decide not to get it?
I mean, if you're not going to get the vaccine, your risk of getting COVID is much higher than if you're going to get the vaccine. I mean, you think about 95% effectiveness. If we look at the numbers as of today, 1 in 15 Americans have had COVID. And given our disease rate, there's probably another 1 in that 15. So a second one that's got COVID right now, which means your chances of getting it are pretty high. And, while fatality is low, it's still not fun to get it. And we want to prevent that.
We do not know really, because there's a lot of long-termers that they're getting it in 6 months down the road. They still can't shake, the shortness of breath and stuff like that. So it really is important. Yeah. Really quickly, 30 seconds. Tell us about Silver Summit Health Plan for those who don't know.
Yeah, so Silver Summit is an insurance carrier that we provide coverage for Nevadans for both the marketplace, for Medicaid, and through Medicare as well. And we do that to all Nevadans, provide high quality, coordinated, compassionate care.
Awesome. Good man.
Dr. Jeff Morawski, thank you for joining us.
Thanks for having me.
I'm ready. Reserve it. Boom.
Yep.
Hit me.
Yep.
I'll take both of them.
Right there.
I mean, one Moderna, one all of them.
Well, my hope is that it looks like mid-February they may approve Johnson & Johnson.
Yep. And that could be a one shot.
That's a one shot. It is going to be approved. If it's going to go, it's going to go as a one shot.
And if that's the case,
that might be what you'd see. It becomes a lot easier.
Yeah.
And that's what you'd see go out to the general public. The second thing is I can't comment on vaccination timelines now because on January 20th, we're going to have a completely different plan for vaccination.
Yeah.
One that's organized and doesn't disagree with vaccinating people. So it's very possible that I have a friend, he works in Oregon. They just called out the National Guard. They're using the Oregon Guard to vaccinate. Yep. Mm-hmm. So I think you're going to see a different plan January, February that may get us better than September, might push us into July to hit everybody.
Doctor, thank you so much.
Maybe if we're lucky, earlier. Thank you.
Appreciate
Great
you.
to have you.
Thank you.
If you want to learn more, go to silversummithealthplan.com. Silver Summit Health Plan, a proud sponsor of the Morning Blend.